Thank you, Chairman Alexander. I want to thank you, Mr. Chairman and Ranking Member Murray, for your work on this important bipartisan package, and in particular for continuing to work with us on this measure to end the practice of surprise medical billing. We've been able to make improvements to the package over the past week that will provide prompt payment for doctors, give states the ability to determine their geographic areas for the purpose of payment rates, identify access and hardship issues in rural communities, and increase the ability of HHS to make adjustments should issues arise. These are positive steps that have strengthened this package, and I look forward to continuing to work on strengthening it even further before it moves to the floor. It is completely outrageous that patients do everything they can to ensure that their care is in their insurance network, and yet they still open the mail to find huge, unanticipated medical bills. Just last week, I met with a number of constituents about rising health care costs, including Sarah Stewart of Dover, who received a surprise medical bill for $700 after having surgery at an in-network hospital. While the hospital was in-network, she found out after the fact that the independent anesthesiology group was not. After Sarah had been stonewalled for months trying to negotiate the bill, it only took a matter of hours after our discussion and following inquiries from the local newspaper, the Portsmouth Herald, for her bill to be eliminated in full. I'm extremely grateful for the work of reporters in New Hampshire and across the country to shine a spotlight on these individual cases. But that is no way to run a healthcare system. We should not need media coverage of individual stories to get specific surprise bills taken care of. What we need is comprehensive action to end the practice of surprise medical billing. My top priority throughout this process has been taking patients out of the middle of billing disputes between providers and plans, and that's what this bill would do. While this bill in its current form takes a different approach to resolving the disputes than the bill I introduced with Senators Cassidy, Murkowski, and others, I appreciate the Chair and Ranking Members working with us on the amendment we will vote on today, Amendment 3, which will improve patients' Cassidy Amendment 3, which will improve patients' ability to determine whether a health plan has adequate networks before choosing that plan. This is especially critical for people in rural communities. I'm also grateful to the Chair and Ranking Member for their commitment to continue discussions with us about including an independent dispute resolution mechanism as this bill progresses to the floor. There are, of course, far larger issues in our healthcare system that still need to be addressed. But as people continue to get surprise medical bills in the mail every day, we cannot wait to act. And I'm grateful that this committee has come together across party lines to take action on this pressing issue. Thank you.